Assalamu alaikum. I'm Dr. Munis Mukhtar, consultant implantologist and periodontologist at Aesthetics and Dental Implantology Center located at Khayaban-e-Tanzeem, DHA Phase 5. This is my specialty. We will be talking about dental implants. It's a very long-awaited topic from my side. I would like to just talk brief about dental implants. What's basically dental implant is? Dental implant, or it's a screw, it's a titanium screw, which is actually a natural, which is replacement of a root. Normally, our natural tooth has two portions. One is root and the other one is crown. So dental implant itself is a replacement of a root, and then there are different connections. There are different, you can say, props. आसान ज़ुबान में हम ये कह सकते हैं. Depending upon the need we have in that specific area. If we have to restore a single tooth, अगर हमने एक दांत restore करना है, it could be a single crown that will be replaced. If we need to make a bridge, like we need to restore 3 teeth in one arch, so we can place maybe 2 implants. Sometimes 3 implants as well. When we place 2 implants, then we make a bridge between 2 implants and we make it like 3 unit bridge. इसमें 3 दांत होते हैं जो कि नजर आते हैं पेशेंट के मिसिंग जो, और इम्प्लांट का जो पोर्शन है वो हड्डी के अंदर होता है. पेशेंट अक्सर ये सुन के थोड़ा सा घबरा जाता है कि डॉक्टर साहब आप टाइटेनियम की कील मेरे मुंह में डालेंगे तो is it going to be painful? As I consistently being saying the same thing and I'm saying it again, at our clinic it's absolutely a pain-free procedure provided you follow proper instructions. Obviously we have certain protocols which we've been following for many years, and we have concluded and come a very long way. We have come a long way to make this thing possible pain-free for my patient. How we do it? It's a small surgery in a local anesthesia. First and foremost, it's not a general anesthesia procedure most of the time. Where we give local anesthesia, we just open the flap, which is the gums. We locate the bone, which we actually planned it while seeing patients' x-rays and 3D CT scans. So we actually know the quality and the quantity of bone we will be working on. So this is a part of treatment plan. When a patient comes to me, we take certain pictures, certain x-rays, get 3D done, and we evaluate our patient. So we, before placing an implant or before doing a surgery, I have already done a virtual surgery on my computer to make seeing the result of what I'll be doing on my patient. So yes, technology has been advanced and digital dentistry has evolved in such a way that before placing a knife on my patient, I can actually see the result and I can show those results as well to my patient. So we get these stents designed from the lab. We have very nicely equipped lab in Pakistan now as well, mashallah. We designed our cases first and foremost. So everything is being done before touching my patient. So I just keep those records, which we call the pre-operative records, which include x-rays, pictures, models, scans. And with the help of all these things, we conclude our virtual surgery and we actually come up with a crown, which is naturally looking. And before placing an implant inside the mouth, we can show the case to the patient that, okay, this will be your result after maybe 2 months or 1.5 months or maybe the day you will leave my clinic. So 2 things, implant is a replacement of a root. Then we have a crown on it, which has different varieties. Obviously, depending upon the patient needs and demands, we can give you the crown you need. For implants, you need to have proper bone and proper soft tissue. Soft tissue means the gums. So if a patient comes to me after extracting his tooth maybe 5 years ago or maybe 10 years ago, so I'm assuming, and this is for sure, that he will be short of soft tissue and hard tissue. Soft tissue means once again gums and hard tissue means bone. So in that case, it's not a simple steadily doing case. We need to graft everything back and then place an implant. So in certain cases, we do everything together. Yes, we can do everything together, but there are certain cases where we can't do everything in just one go. So we need to step the surgery. We need to divide that surgery. Maybe in a first go, we go for hard tissue and implant, and then in a second stage we can, what we call second stage first. Okay, let me clear this thing. Second stage का मकसद ये है, हम जब implant place करते हैं तो it's a surgical intervention. हम implant को gums के अंदर रख के stitch कर देते हैं, and then implant is inside the bone, so you can't see it once it's healed. So in order to make a crown on the implant, we need to do a small surgery. Why am I saying it's a surgery? Because obviously I'll be using anesthesia and a blade, but as I said, it's absolutely pain-free. This is what we call, we expose the implant, we place a healing abutment which we call the gingival collar, which we form the collar around our implant, and then we take an impression or scan the impression, send it to the lab, then your crown comes and we give you the crown. This is the permanent and the secondary crown which we give. The primary crown or the immediate crown normally we give, especially in aesthetic zone, on the day of surgery. Yes, on the day of surgery, while I'll be doing your surgery, once you leave my clinic, you have your teeth in your mouth. That's my responsibility. That's actually we do. That's a protocol at our clinic, especially for aesthetic zone. I'm repeating again and again, it's only for aesthetic zone, not for the functional region. Sometimes if we believe that patient is cooperative enough that he or she realizes that he should not bite on that tooth which we placed immediately, so he can keep that immediate crown as well. Otherwise, I prefer not to go for the functional crowns in the posterior region. Implant is actually a closest alternative of a natural tooth. Implant itself, it's a titanium screw, titanium grade 4 or grade 5. It depends upon the manufacturer. Most of the implants which are being used are FDA or CE approved. So all of them or most of them are of equal quality. Once we placed with a sterilized environment, there is a very least chance of infection if you have actually followed the protocol. So once we place the implant, and if needed, we have to place the bone as well. So we just close it. That's our first surgery. We just let it heal for maybe 2 months. Sometimes we need 3 months and sometimes it's 6 months depending upon the amount of bone we have grafted in that area. After 4 months or 5 months or maybe 6 months, we reopen it, we take an impression or a scan, and then we send your scan to the lab and you get the crown within a span of maybe 7 days or 15 days depending upon the complexity of your case. Let's conclude our discussion today. Implant is so far the most successful advancement in the field of dentistry. Yes, it has failures, but in a proper controlled way, and if you have done all the prognostic and diagnostic records and tests done, and if patient maintains good oral hygiene and physiological condition, then implant has at least minimum lifespan of 15 to 20 years. Yes, and I really mean it. But sometimes dentists say it's a lifelong procedure or it's a lifelong prosthesis. Trust me, God has made the best thing for you. You couldn't keep it for your whole life. So implant is a man-made thing. You can't keep it that way unless you are really adamant. At least we say now it's a second lifeline for my patient. If he or she wants and if he or she keeps it well, yes, it has a very good lifespan. But saying that it's a life, it's for your life. Allah Ta'ala aapko zindagi achhi de. If you have come to me in the age of 20s and mashallah, if you live for 80, 90 years, definitely implant is not going to last. But yes, for a properly done implant, it has a good lifespan, and I have my own data of at least 25 years. There are my patients who I treated 22 years ago or 23 years ago, 25 years ago, because I keep follow-up of my all patients, at least most of them, keep the records, keep the x-rays. That's how it works. This is all about implants. In case of any further query, any further questions, you can always come back to us. You can always write it down and we'll be more than happy to answer your concerns. Thank you very much. Assalamu alaikum.